Hospitals are strange places at night. The hum of fluorescent lights, the faint beep of monitors, and the hollow echo of footsteps in empty corridors can turn even the most rational mind uneasy. For Sarah, a nurse at St. Augustine's General, the night shift had always been routine until that fateful evening. Sarah was assigned to the ICU, a quiet ward with only a handful of patients. Most were elderly, clinging to life by a thread, their rooms filled with the soft hiss of ventilators. But tonight, something felt off. At 11:45 p.m., the first incident occurred. Sarah was checking the vitals of Mr. Henderson, a frail man in his 80s recovering from a stroke. As she adjusted his IV, the lights flickered. She glanced up, her heart skipping a beat. "Old wiring," she muttered to herself. But Mr. Henderson's eyes, previously closed, snapped open. He stared past her, his pupils wide with terror. "She's here," he rasped, his voice trembling. Sarah froze. "Who's here, Mr. Henderson?" "The woman, the one in black," he whispered, before his eyes rolled back, and his monitors began to scream. She called for help, and the team managed to stabilize him. But his words lingered in her mind. By 1 a.m., the ward had settled down again. Sarah sat at the nurse's station, sipping coffee and trying to shake the unease gnawing at her. That's when she saw it. Down the hallway, just at the edge of the dim light, a shadow moved. It wasn't the shadow of a patient or a doctor. It was too tall, too fluid. She blinked, thinking her tired eyes were playing tricks on her. But then it moved again, gliding silently toward room 306, Mr. Henderson's room. "Hello?" she called out, her voice echoing in the empty corridor. No response. Summoning her courage, she grabbed a flashlight and headed toward the room. The door was ajar, and the air inside was icy cold. "Mr. Henderson," she whispered, stepping inside. The old man was sitting up in bed, his face pale as death, his eyes locked onto hers. "She's here," he croaked again, pointing to the corner of the room. Sarah turned her flashlight toward the corner, but it revealed only an empty chair and a blank wall. Yet the feeling of being watched was overwhelming. "Try to rest, Mr. Henderson," she said, her voice shaking. But as she turned to leave, she heard a soft, sinister laugh. At 2:30 a.m., Sarah decided to take a break. She stepped into the staff elevator, pressing the button for the cafeteria on the ground floor. The elevator doors slid shut with a groan, and the car began its descent. But halfway down, it jolted to a stop. The lights flickered, then went out, plunging her into darkness. "Great," she muttered, fumbling for her phone to use its flashlight. Before she could turn it on, a low whisper filled the elevator. "Sarah." Her blood ran cold. "Who's there?" she demanded, her voice echoing in the confined space. The whisper came again, closer this time. "Sarah, you shouldn't be here." The air grew thick and a foul smell like rotting flesh filled the elevator. She pounded on the emergency button, her heart racing. The lights flickered back on, and the elevator resumed its descent. When the doors opened, Sarah stumbled out, gasping for air. The cafeteria was empty, but the smell lingered, as if something had followed her. By 4 a.m., Sarah was back at the nurse's station, trying to convince herself she was just overtired. But the atmosphere in the ICU had changed. The air was heavy, and the usual sounds of the ward seemed muffled, as if the building itself were holding its breath. That's when the alarms started. One by one, the monitors in the patients' rooms began to beep frantically. Sarah and the other nurses rushed from room to room, but each time they found nothing wrong. The patients were stable, their vitals normal. Then from room 306 came a blood-curdling scream. Sarah ran to Mr. Henderson's room, but when she entered, she stopped dead in her tracks. Standing at the foot of his bed was a figure cloaked in black. Its face was obscured by a dark veil, but its presence radiated malice. Mr. Henderson was thrashing in his bed, his eyes wide with terror. "Get her away from me!" he screamed. Sarah reached for the call button, but the figure turned its head toward her. Though it had no visible eyes, she felt its gaze pierce through her. The room went dark, and a deafening silence filled the air. When the lights flickered back on, the figure was gone. Mr. Henderson lay still, his face frozen in a mask of fear. The monitor flatlined. The death was ruled as natural causes, but Sarah knew better. The figure in black was no hallucination. Over the next few nights, more patients in the ICU reported seeing the same entity. Some described it as a shadow, others as a woman in a black dress. The hospital staff began to whisper about the ICU Reaper, a spirit that came for the dying. Sarah tried to rationalize it, but the memory of that night haunted her. A week later, she resigned from St. Augustine's General. She never worked another night shift again, but sometimes, in the quiet hours of the night, she wakes up in a cold sweat, convinced she can still hear that sinister laugh echoing in the darkness.